welcome to the stage. I thought this was a great way to wrap things up because to take a broad view of what's happening across the nation, let's talk a little bit about where you're from, the National Association of Counties. I'll give the brief version. You can kind of give the brushstroke on top of that. So your organization represents the county, 3,069 counties across the United States. And your members, you advocate on their behalf in Washington, focus on best practices. What else am I missing there?
Well, that's the focus. We represent 40,000 elected officials. So that will be supervisors and commissioners, also sheriffs, treasurers, county clerks, anyone who is elected in county government. And we advocate on their behalf, as Mitch said, at the federal level. And then my role is to scale best practices across the country. And so of the 3,069 counties, 2/3 are rural, and 118 counties have 500,000 people or above. And so while there are huge differences in resources and capacity, I wish every county could have a storyteller. That's not the reality for most of our counties, but they're all dealing with similar issues around jail populations, around healthcare. And so it's our job to sort of help them deal with those issues where they are and with the capacities that they have.
And, when we talk about data in counties, as you say, it's kind of an uneven landscape as far as resources go. To what extent are they embracing data? Do you see it just being some of the leading cities, or counties who are excellently resourced, being in New York City, who are highly resourced, or is it all over the map? Some of the rural counties are looking at it. Who's leading the way, and how even or disparate is adoption?
Sure. I mean, as you would assume, many of the larger counties do have the capacity and are able to do a lot of what we heard about today in New York City. But we also have smaller counties, Johnson County, Kansas, doing incredible work in data and analytics. And so what we try to do is divide them into cohorts. Based on size and capacity, and talk to them about where they are. It's not gonna, I came from Los Angeles County, over 10 million people, the largest county in the country. What they're doing there is not going to be applicable to many of our counties. And so how can we sort of balance and help them get started? And that's kind of where I'm seeing a lot of counties. They have a lot of data, but what matters in that data? Where are the outcomes in using and analyzing that data?
Yeah, so I do want to get to some of the specific things counties are doing, but you mentioned the cohorts and all. I want to talk about how you all are both enabling counties around data, but also some of the other work you might be doing around data. Could you kind of elaborate on NACO's role?
Sure. So we also have a research arm which takes a look nationally at what's happening in counties across the country. And everyone may not be as familiar, but counties do health, human services. We have 46% of the roads in this country. We operate 900 hospitals. We have coroners. We have child welfare systems, 2,000 public health departments. I often say that if you're going to a county, you're probably not having a good day. Because we are really the ultimate safety net for folks who have nowhere else to go. And so as much as we're able to use data to both tell the story of counties and the work that we're doing, and individually have counties use that data to better allocate resources, is sort of where we're focused.
Yeah, and so going back to your members for a bit, I'm sure you love all your children equally, but is there one county story that particularly excites you around data that is kind of the one that that sticks in your mind when you talk about?
Sure. I think one of the things that we're working on right now is economic mobility issues. If you're aware of the Raj Chetty zip code data, we're spending a lot of time looking at not just how that impacts the country and counties, but individually within counties. And one county that's doing some incredible work in this area is Multnomah County, which you may know as Portland. Obviously, a lot of gentrification, displacement issues there. And so that county has developed a marginalization index. And it's interesting in what they're doing, but also how they did it. And so they took a look at where there were specific areas of potential marginalization and how they could better allocate their resources to those communities. And they also found that anytime they were launching a new service or program, they were basically starting at ground zero again and like gathering data and trying to get departments to communicate and share that data. So what they did was try to create something that could be used county-wide. And they started with 60 data points, which was obviously too many, and a challenge to keep up to date, to be sharing across departments and agencies. And so what they did was they took it out to the community. And I think that's sort of a unique thing for government to do, and something that we want to share with other counties, and got reaction from the community to these data points. And they've now taken it down to about 22 indicators that they're sharing across the county. And that may not be applicable, all 22, for things that they're working on, but what can they pull from that data? And it also forced all the agencies to come together and be willing to share that. Because what I have seen, and I certainly saw in Los Angeles County, was that it's not always about the cultural issues of sharing data, and I don't want you to see what's going on in my department, but sometimes it's antiquated systems as well. Even in large counties, you'd be stunned, I think, at how bad some of the systems are and their inability to share that across agencies. And so Multnomah has really invested in that and focused on this marginalization index, gone to the community, gotten their buy-in, and now they're starting to use that to influence investment across the county. We are currently launching a project with the Gates Foundation where we're going to be bringing counties from across the country to see what's going on in Multnomah and be able to, hopefully take that back to their own counties and be able to build similar systems that are applicable to their community.
And so just to kind of put a fine point on it, how are they utilizing this data? Is it to deliver services better? Is it and what sort of results are they kind of pulling out of that?
Well, they're just starting. Like in many communities, I think it's Highway 205 in Portland. If you can see that's a great divider in that community, and sort of, the wealthier folks are on one side and the areas of poverty on the other. And when you look at the data and the indicators that they've been able to develop, they are now targeting resources specifically to those areas, where before they had more of a blanket approach. We have this issue, obviously, of affordable housing in Portland, and targeting resources in sort of a blanket way. This allows them to be more intentional and hopefully more effective. And so they're just starting to measure their actual impact, but I think the way that they're approaching it is very powerful.
Nice. And I'm just curious because, especially with counties, as you said, they often are providers of last resort. Mm-hmm. You deal with a lot of social, personally identifiable information. A lot of those programs like Medicaid have strict regulations from the federal mm-hmm. level. Do you find your members saying the regulatory structures that they have to work under kind of restrict their ability beyond the kind of legacy system issues and all that? How much do you hear about the regulatory structures and what that means for what they can and can't do?
I think we try to help them navigate that space. I mean, you can easily, HIPAA, we can't do anything, right? We've tried to help them navigate that. I don't want to offend any lawyers in the room, but sometimes that can be sort of, legal says we can't do it. Well, why? Why can't we do it? And are there ways that we can navigate the systems better? And so we spend a lot of time in webinars and peer exchanges talking about that and showcasing counties where they have overcome that, where it isn't just an excuse, but they are able to work within the system.
So kind of continuing down that road, if you all do a great job of identifying best practices across the country and trying to make sure your members are aware of them. And they wouldn't be called best practices if they were widely adopted, right? Mm-hmm. So how do we institutionalize things nationally when, counties, and as you said, all your counties are very diverse. And, New York City, there's kind of county functions, multiple county functions going on. Massachusetts doesn't have counties, for instance. How do we kind of take these best practices and try and normalize what works across, to steal where Zach's from kind of line? How do we normalize and institutionalize things across the federated kind of model of government that we have here in the United States?
I think it's just recognizing that all counties are not the same in our case. And so what we try to do is build toolkits for them. That ask them, start with a series of questions of where they are. and what they need to do to make progress. What are the biggest challenges that they're facing? And that could be data related, specific elements of data that they're challenged by. That could be systems related. And so it's ensuring that, yes, it's the same problem. Yes, there are some templates of solutions that we can provide to our counties, but ensuring that we're asking the right questions on the ground and what matters within your community, what help do you need, and then we will help develop tools and resources for them to address that specific need.
I want to talk about a little bit around the opioid epidemic, because I know it's something your organization has been both following and trying to provide best practices around. And I feel, having worked on the public safety side of things before, when the opioid crisis became extreme over the past few years, half decade or so, data started to become a rich factor in not just tracking it, but trying to determine solutions. Could you talk a bit about your viewpoint of that from working with the kind of health and social safety net? And actually, as you know, and maybe the audience knows, the jails are often run by counties most places. So there's the criminal justice side of it as well.
Sure, and that's probably the piece that most people would assume. Counties run 91% of the jails, local jails in the country, and 11 million people cycle through those jails every year. A lot of them high utilizers, and the opioid crisis has certainly put a light on that. This is a huge issue for our counties, and it certainly resonates within public safety, but other issues that you may not think about. So our coroners are devastated by this, and I'm sorry to do this before lunch, but they've run out of space. And so they brought in refrigerator trucks, essentially, to be able to put bodies and sort of cycle through all the work that they don't have the resources. Another area where we've seen huge issues is around child welfare. We've seen incredible spikes in our child welfare system, particularly in communities where opioids have been an issue. And so if you look at increases from 2012 to 2016, height of the opioid crisis, 6 states in the country had increases of 50% in their child welfare systems. And you can map that data to the impact of the opioid crisis. And so I think that the major tool that counties are using is some have created sort of dashboards from the perspective of how is criminal justice working on the system, how are we using medical assisted treatments in communities, where are we finding seizures of drugs, where are people turning in drugs, where are there overdoses, where are there deaths. And just because of the extreme stretch on our systems because of the opioid crisis, those dashboards give us an opportunity to really direct resources to where they're needed. And I think that's where counties have really been effectively using data.
Do you think it's also helped, going back to the immediate past panel, with the storytelling around the epidemic and how we approach these issues as well?
I think that's something that we're trying to continually work on at NACO. Is there, this is the policy advocacy. We need more money, right? And we'll go and knock on federal doors for that funding. But also, looking at when I talk about the child welfare system, that's a huge impact on our systems, and being able to showcase that tie to the opioid crisis is really important. And then you need the human face on that story and the devastation that not just communities, but families have felt. And so we've spent a lot of time talking about grandparents and how they are now raising their grandchildren because the parents are not able to function in that role at this time. And so being able to incorporate all those elements of the story has been very powerful for us in telling that story, particularly in regions like Appalachia, which have just been devastated by the opioid crisis.
Connecting that with the criminal justice system, I know you all have had your DataDriven Justice initiative, and that seems to be taking the data around what is actually happening in our nation's jails and county jails and telling a story about really not only what is happening, but how do we move forward in a way that helps everyone and lifts all boats. Could you talk a little bit about the initiative?
Sure. This is sort of where we started with data, just because, as I mentioned, we run 91% of the jails. 11 million people are cycling through those jails every year. And so you can look at it pragmatically and the cost implications, and we can also look at it from an outcomes situation. We're not servicing these people well if they continue to cycle through our jails and through homelessness and not being able to hold a steady income. And so what we've done is we launched an initiative called Stepping Up, that over 500 counties have signed a resolution to commit to addressing the issue of mental health in jails, to stop that cycling process. And so what we've done is look at the data around mental health in jails. Over 25% of the people in our jails have severe mental illness. 65% of the people in our jails have some level of mental illness and substance abuse issues. If we continue to put them in jail, they're never going to get out of that cycle. And so this program focuses on looking at how can we use that data that we're gathering within communities to bring together mental health systems, to bring together our public health system, housing, workforce training. How can everyone come together to better serve that person? Because it's very expensive to have people just continually cycling through.
You know, one thing that we've talked about previously that hasn't come up yet today, which I think is, and maybe it's because we're in New York City, which is a different animal, is innovative financing and data's role in that. Could you talk about some of the tools and how you build the right data to really, maybe whether it be social impact bonds or kind of performance-based contracts, what have been the county experiences with kind of those sort of, and that's a huge question, I know,
Sure.
in the short period of time.
No, it happens to be something I'm very passionate about. When we talk about the future of data, I think that this is somewhere that counties and I'm sure cities need to be addressing. I actually worked in the office in Los Angeles County that launched the first social impact bond in Los Angeles County. And the issue is that it just takes forever to come to agreement on what those measurements are going to be in order to look at a pay-for-success model. And it was taking like 18 months to get to the point of agreeing metrics across departments. People lose interest in that, and it becomes very laborious to gather people and not get to agreement. The bottom line, though, is that I think it's a good thing. You know, the private sector has expectations around outcomes and metrics that we haven't always used. And so our ability to develop those metrics, showcase that investment has a return is really important. And that's in pay for success, social impact bonds, it's in rate cards, it's in opportunity zones, which are sort of the big thing right now. If we want to entice private investors to focus on our communities, we have to be able to show that they're going to get a return. And they may be willing to take a slightly less return if there's a social impact to what they're doing, but they still want to see metrics around what we're doing. And so we're trying to build that into the culture. We're working with some folks who are helping us template that model. So there are some systems that have a little bit more agreed upon metrics. Early childhood or workforce development are two areas where we're trying to build models that our counties can use and don't have to start from scratch, which from my own experience just can be frustrating and not motivating for people to keep working on when you're working on it year after year.
Just want to see, do we have questions from the audience before because I have some more, but I want to make sure you all get involved, if not. Okay, so if anyone has one, I'll come back to you. But analytics and kind of advanced data analytics and some of the whiz-pow-bang stuff that's kind of coming out there, whether it be around gathering data through the internet of, internet arrays or, so on and so forth. What has been kind of the county experience with this so far, and what's your advice as some of your members might come to you and say, I've been pitched that we should connect every traffic light and, measure everyone's movements or whatever the case may be?
I think it's an exciting time, and I think there are a lot of tools out there that will help counties better target resources, better meet the needs of those who really need it within their communities. And you're right, there's a lot of shiny new object within county officials. It's exciting, right? I think the two areas that I'm focused on is just ensuring that they're thinking about around predictive analytics. We're doing some work in Miami-Dade and in Johnson County, Kansas, which I mentioned, where they're looking at folks that they know have been cycling through our mental health systems. And so when you look at some of the predictive analytics around that, we just worry about, yes, we want to be able to target, yes, we want to get them services in a proactive way, but where does that then become aligned with the criminal justice system, right? And so just being cautious of that and making sure that as they're developing the systems, they're thinking about it. The other thing would be around risk assessment, particularly related to our jails. And when you look at some of the systems that are being developed around risk assessment, human beings are developing those systems. There's a lot of discussion around bias in those systems, particularly from a racial viewpoint. And so when you're looking at pretrial freedom and risk assessment, what does that mean for communities, particularly of people of color who may have a higher risk score based on what systems are developing? And so from our perspective, I think this stuff is great. I want our counties talking about it. I just want to be sure that we're also giving them a cautionary tale of making sure that the predictive analytics, risk assessments, that we're thinking about what those issues could mean in our communities.
I wanted to check and make sure. Does anyone have any questions before I ask a few more? I kind of want to pull that thread a little bit more because, and I'm going to pick on a municipality here, but there are, folks who are looking at body cameras and facial recognition, and it's also used in our jails and so on. And recent evidence shows that it has a better understanding of a face if it's white and male. So there's a lot of those sort of issues that are kind of arising as we, whether it's programmed by humans and they just showed a lot of white and male faces along the way, or it's bias in the algorithms based on the initial data set, which I believe was a child welfare issue with a data set in Pennsylvania at some point. Do you think there's how do you think the awareness around, are we getting better at saying this isn't just exciting, but we also have to be thoughtful about how we're doing this? Or how do you see that landscape look overall? What do you hear from your members on that specifically?
They get into some pretty heated debates at our peer exchanges on this issue. Because there is the wealth and power of the tools, but also the recognition around what that can mean for certain communities. So are they aware? Yes. Are they passionate about the potential? Yes. But there's also that recognition. Now, I would say that that's probably in our top highly populous counties that are more ingrained in these issues, but I'm seeing it move to our suburban communities, and we try to ensure that we're talking about it at all of our events and peer exchanges so that folks are engaged in thinking about it.
Do you see a playbook kind of arising for adoption around this over time of kind of data and analytics for some of your counties who may be starting relatively fresh? Is there somewhere you would suggest those who are relatively fresh on these issues look?
Sure. I mean, I think we've started, as I mentioned, around the criminal justice system and sort of helping them develop the tools and how do you work with others and how do you need to bring them into the discussions that you're having. We recently had a sort of what we call Healthy Counties event where we brought together commissioners and department leaders from across the country to talk about what you do with this data. Health means something different than it used to, and we're looking at the social determinants and how access to healthy foods and transit access and childcare and affordable housing. And so we brought them into a room and gave them data sets for within their community. And then one of our partners, Esri, helped us map that within their communities. And so they're not going to be, the elected official is not going to be the data expert, but we think it's really important for them to see how it gets used and the importance of it. So no matter where they are, it could be you need to bring this to your county, or you need to be thinking about the impacts within the departments within your county. And it was great just to see, I mean, they were super excited to really dive into what that data means and how they're looking at issues of equity in their community. And it's a very powerful way for us to talk about some of the newer issues that we're working on when it comes to issues around equity in particular, or the future of work. It's one thing to say this is really important and you need to think about it, and another thing to be able to actually show them the data of their own community. And you can serve a community for 20 years and think you know it, but then when you actually see that data mapped out, I think it's been really powerful for our counties.
Well, I think that's a great note to end this conversation on. I appreciate you coming, Cheryl.
Thank you.
Let's give a round of applause for Cheryl.
Thank you.
And,